A protruding belly is a problem that can affect anyone at some point in their life. A protruding belly is not always related to excess weight. In this video, I will talk to you about the causes of a protruding belly and give you some recommendations. Watch until the end. Have you noticed thin people who don't have noticeable subcutaneous fat, yet their lower belly sticks out? And the most interesting thing is that these people can even go to the gym and do exhausting workouts. They work on their abs, but that lower belly just won't budge. Oh, what's going on here? The thing is, as I said, it is not connected. The subcutaneous fat is related to the internal organs and the position of the pelvis. Let's break down the mechanics. Look, we have the pelvis, the internal organs of the pelvis, and then we have the organs of the abdominal cavity above. We have the diaphragm, the abdominal diaphragm, and here we have the lungs and the heart. And the spine, on which everything is essentially suspended. So the belly is located between two diaphragms. The pelvic diaphragm and the thoracoabdominal diaphragm. When a person inhales, the thoracoabdominal diaphragm descends. As a result, intra-abdominal pressure builds up, and this pressure extends down to the pelvic diaphragm. One of the first reasons why a belly develops is due to diaphragm dysfunction. Specifically, when the pelvic diaphragm is in a state of tension, this is a dysfunction of the diaphragm. So, especially when the pelvic diaphragm is in a state of tension, in stagnation, the thoracoabdominal diaphragm increases pressure, leading to a protruding belly due to the pelvic diaphragm being tense. Intra-abdominal pressure causes the belly to protrude. This is because the pelvic diaphragm is simply in a tight, tense state. The second point, this is related to biomechanics, to the position of the pelvis. So the pelvis can be in a neutral position, straight, but often the pelvis tilts forward. This leads to an increased lumbar curve. This also contributes to the internal organs being pushed down. There's another interesting point that comes into play here. These are antagonist muscles. There are muscles, for example, the quadriceps, the four-headed muscle, and the iliopsoas muscles that go into tension. You might even develop a waddling gait. So, the more your pelvis is tilted forward, the more your abdominal muscles relax. And you can do crunches as much as you want, but it's all about neurology. So, you do crunches and crunches, but then if you walk like this, your abdominal muscles just relax. So, until you get your pelvis in the right position, your belly will always be weak, and your glutes will be weak too. But this is also related to the pelvic diaphragm. In reality, there are no simple explanations here. It's actually a whole complex of mechanisms that overlap and worsen the situation. But that's not all. Even from childhood, especially in children, if you've seen a protruding belly, it can actually be related to the improper formation of a walking pattern. So, if a person has been walking incorrectly since childhood with a tilted pelvis, it will also lead to a deterioration in posture. The head, meaning the neck, shortens and the belly will stick out. It's also a chain of disorders, starting from the feet and ending at the crown of the head. What other factors could there be? What I've noticed in my practice are birth injuries, cranial injuries in children when they go through the birth canal or when they are inside the womb, often leading to big trauma to the bones of the skull. And with any head injury, compression occurs. This leads to a reduction in the distance between the head and the pelvis. It contracts, causing an increase in the curve and worsening of the hunch in the thoracic region. So the body kind of compresses like this. That's also one of the reasons why the belly might stick out. Another reason is injuries to the coccyx bones. Many people have fallen on their coccyx, injured it, or have been riding and fallen somewhere else. Injury to the coccyx also leads to the whole area getting compressed, and the pelvis also goes into anterior rotation. Look at how many factors there are. And so to say that you can just go on a diet and everything will be fine, well, it will only go away in a healthy person if they really just overate. But if he's thin and has a protruding belly, that's actually a problem. Along with all this, there are even other factors. These are surgeries. Surgery on the abdomen creates scars. And the peritoneum itself, a sac that is located in an internal organ. If you cut the peritoneum with a scalpel, that is, it spasms, contracts, scars, and adhesions are formed. Any intervention, especially if it's a cesarean section. I've often seen women who come to me for a consultation and they have a protruding belly. After childbirth, after a cesarean, because trauma to the peritoneum often leads to stagnation and swelling. And here, to get rid of the belly, you just need to work with the internal organs. All of this needs to be restored, addressing the injuries that were sustained, starting from a traumatic brain injury all the way down to the coccyx. Work with the diaphragm muscles so that they function properly. And if there have been surgeries, you definitely need to work on the scars, because any scar will create significant restrictions. And then the organs and tissues straighten out and the belly gets tighter. Another important factor is, of course, psychosomatics. First and foremost, it's fear, anxiety, and worry, because it's the pelvic area. that is responsible for intense emotions. If you are in a state of chronic anxiety and fear, that can also be one of the reasons. Why do you have a protruding belly? So, if you really have a pronounced problem, you see, posture curvature and other issues with the internal organs require a comprehensive approach. But there's one magical exercise that I'm going to show you right now. So, let's get started with the technique. This technique is quite simple and very effective. The main thing is to do it regularly. And of course, it's important to do it mindfully. So you really need to feel well what you are going to do. And you will be untangling this knot in the pelvic area. All the pelvic fascia, they become tight. They pull and compress, and they pull both the abdominal wall and the internal organs down. You need to untangle this knot. So above the frontal joint, above the pubis, you place your straight fingers. They should be quite firm, not soft, and slowly push them in as deep as possible. The stomach is as relaxed as possible. It's better to close your eyes. Feel as if you're moving through oil. This is how you penetrate deeper and deeper with the knife until you reach something hard. You need to reach something dense and hard to the touch. So you've reached something dense, and then you kind of grab onto that layer, meaning your hands, they become very stiff. They become motionless. So you hold this structure, and here is the most important part. You start to slowly tilt the pelvis. You should feel a rubber band stretching between the pubic symphysis and the fallen fingers. You bring it to tension, and that's it. You maintain that tension. So you hold it, and even better if you breathe, taking deep inhales and exhales. And you can feel how that rubber band gradually unwinds. That's the whole task, really. You just need to create tension like this and breathe. And feel how the pelvic fascia stretches. This lifts the internal organs. You just need to do it more than once. So you relax your pelvis again, dive deeper into the tissues, and grab the tissues. Again, we've reached some kind of solid barrier. We've got it. Hold this structure. And now, look, close your eyes and slowly tilt your pelvis forward. And we feel how the tension has appeared. We found the tension, that's it, hold it. And that's all the work, but actually this is very effective work. So in this way, you draw tension out of the pelvis. This is a technique to do regularly. This is in addition to the fact that you can also do exercises for your abs, burn fat, and train your abdominal muscles. I would also recommend working on the glute muscles and the iliopsoas muscles. This will also have a good effect. Of course, it's better to work with the internal organs next in order to restore the whole body. Like, subscribe, and let me know in the comments how you feel about this technique.